Good morning to all. Today we have to discuss about Kangaroo Mother Care. I am Miss Velvury, M.Sc Nursing, Assistant Professor, Department of Childhood Nursing from ES College of Nursing. So, introduction. Caring low birth weight baby is a great challenge for the neonatal care unit and the family. So mainly in the Kangaroo Mother Care, we have to care low birth weight baby. Low birth weight baby is, the baby weight is less than 2500 grams. So from those babies, you will take care of in the NICU as well as family members also. Kangaroo Mother Care is a low cost approach for the care of low birth weight baby. Mainly in the Kangaroo Mother Care, we will special care of low birth weight baby only. It is a very low cost approach method. Next, the method of care was introduced and popularized by Dr. Edgar Rey, in which year is 1978. So in the Kangaroo Mother Care, who will introduce this? Dr. Edgar Rey in the year of 1978. It was then developed by Dr. Martinex and Dr. Karpak. Next definition. Kangaroo Mother Care is a special way of caring low birth weight infants by skin to skin contact. So in the Kangaroo Mother Care, we will take care of only low birth weight babies for skin to skin contact. In the skin to skin contact, the mother and the baby should have bondage between both of them, and one more thing, they will maintain the relationship. Second point is, it promotes their health and well-being by effective thermal control, breastfeeding and bonding. With the use of Kangaroo Mother Care, it will promote their health as well as wealth by giving the thermal control. With the use of thermal control to maintain the body temperature at the time we are giving the breastfeeding, and mother and the baby bondage between both of them. KMC is mainly initiated in hospital as well as at the home. We will give hospital also, and KMC should be continued at home also. Three aspects of KMC are Kangaroo positioning, nutrition and follow-up. With the use of three aspects of Kangaroo Mother Care, first we have to maintain the position, second we have to take adequate nutrition and regular follow-up. Next, components of KMC. In the components of KMC, there are mainly two things. First is skin to skin contact, second is exclusive breastfeeding. In the skin to skin contact, the mother and the baby having a direct contact between their mother and baby, continuous prolonged skin to skin contact should be there. For what purpose? To promote the body temperature and to promote the thermal control. Second is exclusive breastfeeding. After the baby will birth, within the hour of birth, the mother will initiate the exclusive breastfeeding to the baby. So in this, it will promote lactation and feeding interaction with exclusive breastfeeding for adequate nutrition and to improve the desired weight gain. With the use of exclusive breastfeeding, we will take adequate nutrition and also weight gain also improve. Next, benefits of KMC. In the benefits of KMC, there are mainly three benefits. First is benefit to the baby, second is benefit to the mother, third one is benefits to the family. So in this, each and every benefits we will see in the later slides. So in the picture of benefits of Kangaroo Mother Care, first you will maintain the baby's body temperature. Second is to regulate the blood sugar levels. Third one is to reduces the infection. Fourth one is improving oxygen saturation level. Fifth one is increases baby's growth and weight gain. Sixth one is improving sleep time. Seventh is it will increases the breastfeeding. At last is decreased crying. Finally, we will go for earlier hospital discharge. Next, benefits to the baby. In the benefits of the baby, first, prolonged skin to skin contact between the mother. So at the time of giving KMC, the mother and the baby having skin to skin contact for 24 hours. KMC facilitates physiological stability in the baby. When you are giving the KMC, it will facilitates physiological stability maintained to the baby. It helps in early discharge of babies from NICU. So when we are giving the KMC, from the early discharge of babies from NICU, it is mainly helpful. It reduces the apnea, that is temporary cessation of breathing, oxygen requirement and risk of infection to the baby. Mainly when you are giving the KMC, it will improve the oxygen requirement and the baby will reduces the risk of infection when we are giving the KMC. Benefits to the mother. In the benefits to the mother, it promotes better mother-infant bonding. So both mother and infant bonding should be there. Mother is less stressed during KMC as the mother is more actively involved in the care. So when we are giving the KMC, the mother will feel very less stress, as well as the mother is actively involved when we are giving the KMC to the baby. Benefits to the family. KMC promotes early discharge of the baby. Mainly it will promote discharge of the baby, early discharge of the baby. KMC facilitates bonding between the baby, mother and the family. It facilitates bondage between the mother as well as baby and also their family members. Preparation for KMC. Before going to do KMC, some of the preparation we will do. So in that, first is counseling. Explain the benefits of KMC to the mother and the family members. Before going to give KMC, first we will explain the KMC benefits to the mother as well as their family members. Demonstrate the procedure to the mother gently with patience. So when we are giving the KMC, we will do the demonstration in front of mother with a patient manner. Answer the questions as asked by the mother and the family members to remove anxiety. At the time of KMC, whatever questions the mother is asked, you will answer the questions and clarify their doubts as well as their family members to remove the anxiety of the KMC. Allow the mother to interact with someone who have already practicing KMC for her baby. So at the time of KMC given to the baby, the mother will interact with some other person because it is one of the practice for the baby. Next, mother's clothing. Mother should wear front open light dress as per local culture mother. So according to their, when we are giving the KMC, according to their convenient, the mother should wear front open dress, light dress as per their local culture. Mother can wear sari, blouse, gown, etc. So mother can also wear their sari also along with their blouse and or otherwise gown at the time of giving the KMC. Baby's clothing. Baby should be dressed with front open, sleeveless shirt, cap, socks and hand gloves. So at the time of giving KMC, the baby should wear front open sleeveless shirt only, as well as cap, socks and hand gloves is necessary when we are giving the KMC. Next, KMC procedure. In the KMC procedure, kangaroo positioning is very important. The baby should be placed between the mother's breast in an upright position, and the baby's head should be turned to one side. Before giving KMC to the baby first placed in the mother's breast. After, the baby head should be turned to one side. Second point, baby's hip should be flexed and abducted in a frog-like position. The arms also flexed. When we are giving the KMC, the baby hip should be flexed and also abducted in a which position is frog-like position, as well as the baby's arms also flexed in the mother's epigastrium region. Baby's abdomen should be placed at the level of mother's epigastrium. When we are giving the Kangaroo Mother Care positioning, the baby abdomen should be placed in the mother's epigastrium region. Next, so in this picture, what shows that KMC position? So when we are giving the KMC, first, baby between the mother's breast. So the baby should be placed in between the mother's breast. Second is, the baby's head should be turned to one side, because of it will improve the oxygenation level to the baby. Third one is, support the baby's bottom. When we are giving the KMC position, the mother will support the baby's bottom also. And the fourth one is, the baby's arms should be flexed in the mother's epigastrium region. Next, feeding. Mothers should explain how to breastfeed while the baby is in KMC position. In the first picture shows that the baby will feed the mother's breast at the time of the baby is in Kangaroo Mother Care position. First, we will explain how to breastfeed to the baby. Next, monitoring. In the second picture, babies receiving KMC should be monitored carefully, especially in the initial stages. So, at the time of duration of initial stage, before going to give KMC, first we have to monitor carefully whether the KMC should be given properly or improperly. Next, third one is privacy. In the third picture, privacy is very important. So, privacy should be maintained to avoid unnecessary exposure on the part of the mother, which makes her nervous and demotivating. So, at the time of giving KMC, privacy should be maintained, because to avoid the unnecessary exposure on the part of the mother, because the mother should become nervous and we have to demotivate the mother also. Next, duration of KMC. Practice 1 hour session initially. When we are giving the KMC should be practiced only 1 hour session. Second point is, transfer the baby to postnatal ward and continue the KMC. After the KMC, the baby should be transferred from postnatal ward. In the postnatal ward, we will give the continuation of KMC. Third point, increases duration up to 10 to 12 hours a day. So, when we are giving the KMC, the duration level should be increased. That is, how many hours is up to 10 to 12 hours per day. We will increases the duration at the time of KMC. Encourage her to increase the duration each time to provide KMC as long as possible. So, when we are giving the KMC, each time it will increases the duration as much as possible. Next, discontinuation of KMC. KMC can be continued until the baby weight around 2500 grams. So, until the baby weight is around 2500 grams, KMC should be continued. Second point is, KMC can be discontinued if the baby starts pulls limbs out when the mother tries to put the baby back into skin contact. So the mother will discontinue the KMC, the baby will start, their limbs will pull out. So as well as the mother will try to put the baby should be back in the skin to skin contact. Third is when we are giving the KMC, the baby will feel comfortable. Fourth point, mother can provide skin to skin contact occasionally after the baby bath and during cold night. So when we are giving the KMC, skin to skin contact when we will give after the baby bath or otherwise during the cold night. Post discharge follow up. Once or twice a week till 37 to 40 weeks or 2.5 to 3 kg post discharge follow up should be continued of KMC. KMC should be given once in 2 to 4 weeks till 3 months. Subsequently, every 1 to 2 months during first year. When we are giving the KMC, every 1 to 2 months at the time of first year. More frequent visits if baby is not growing well. So, frequent visit should be continued if the baby is not growing well at the time of given of KMC. Thank you for all.